Dr. Rahul Chaudhary. He is MBBS MS Ortho. He is trained in spine and scoliosis at Manipal Hospital, Baner. His expertise involved all spinal disorders, include degenerative and fractures, infections, tumors, and deformities. Welcome, Dr. Rahul. Dr. Leena Auti, she is a Bachelor of Physiotherapy, GMC Nagpur. She has a 24 years of vast experience in the field of physiotherapy at Matrix Health Partner, India. May I request the chairpersons to please introduce the speaker.
I am honored to welcome Dr. Ravi Kerhalkar, renowned shoulder surgeon, joint preservation specialist with 10 years of experience. He has done fellowship in orthoscopy and shoulder surgery from Samsung Medical Center, South Korea. Dr. Kerhalkar has keen interest in research work related to shoulder orthoscopy and has been a part of various studies conducted at Sai Shri Hospital. Welcome, sir.
Thank you, ma'am. I know it's not a great time to speak in front of you just before the lunch session. Everyone is hungry, I know. But please bear with me for just 15-20 minutes and we will feast on the lunch together. Good afternoon, everyone. I am Dr. Ravi Kerhalkar, currently working at Sai Shri Hospital as a shoulder specialist. And my topic today is recent advances in the management of rotator cuff tears. We all know that shoulder is a ball and socket type of joint, and it is the joint with the most vast range of motion. It is the most mobile joint. The movement of the shoulder is provided by a group of muscle called rotator cuff. It is formed by 4 muscles, namely subscapularis in the front, supraspinatus in the on the upper side, and infraspinatus and teres minor on the posterior side. In addition to giving stability to the shoulder, they also provide the vast range of motion that is associated with the shoulder. Rotator cuff is, I think, one of the oldest known entity to be diagnosed as a cause of shoulder pain and associated restriction of movements, and various treatment modalities have been recently, the current research is currently going on, and we will discuss with different types of rotator cuff. The causes of rotator cuff can be broadly classified into traumatic and degenerative tears. Traumatic tears are more commonly seen particularly in the younger age group, and degenerative tears, as expected, are more common in the elderly population because of prolonged wear and tear. Rotator cuff is a robust, strong structure and it is not easily damaged. So it is also hypothesized that an element of degeneration is also present previous to the injury in all traumatic rotator cuff tears. The degeneration may be due to overuse associated with professions such as which involves repetitive overhead activities, or impingement of rotator cuff under bony subacromial spur. The risk factors, there are different risk factors. Age, as degenerative tears are more common, and so the age is definitely a risk factor. For unknown reason, males are more prone to develop rotator cuff tears, maybe because of their association with active participation in contact sports or involvement in professions. The professions which involve repeated overhead activities like carpenters, domestic painters, or in sports such as basketball players and baseball players, they have propensity to develop rotator cuff tears. Smoking and type 2 diabetes, because of their effect on connective tissues, they are risk factors for rotator cuff tears. Rotator cuff tears are even seen in higher rates in inflammatory tissue disorders like rheumatoid arthritis and lupus, etc. The symptoms are usually shoulder pain, associated with weakness in the shoulder and restriction of range of movements. Many patients of degenerative tears do not give a history, or they don't even remember of having any history of injury. In traumatic tears, there is definitely an injury associated, but majority of the times we don't see any history of injury in these patients. It has been told by various speakers that physical examination, history taking is a vital in the diagnosis, so as to look for the cause of shoulder pain. Physical examination should be aided by investigations. Musculoskeletal ultrasound can be tried, but MRI remains the diagnostic modality of choice. Rarely, an arthroscopy can also be used as a diagnostic tool. So, in order to understand the management of rotator cuff tears, we first need to understand the different types of rotator cuff tears. So, rotator cuff tears can be broadly classified into partial thickness tears and full thickness tears. Partial thickness tears can be further classified into articular surface tears and bursal surface tears, and full thickness tears, depending on the retraction of torn tendon ends from the greater tuberosity footprint, can be classified into small, where the retraction is less than 1 centimeter, medium, where the retraction is between 1 to 3 centimeters, large tears where the retraction is between 3 to 5 centimeters, and massive tears where the retraction is more than 5 centimeters. Articular surface tears can be further, partial thickness tears can be further classified into grade 1, 2 and 3, depending on the depth of thickness involved. If it is less than 1/4, it is grade 2. If it is less than half, it is, less than 1/4, it is grade 1. If it is less than half, it is grade 2, and more than half, it is grade 3. Why this classification or knowing different types of rotator cuff tears is important is because they decide the management protocol. So, this is the type of partial thickness tears, articular and bursal surface tears into grade 1, 2 and 3. So, there are two management options, the conservative management and the operative or the surgical management. The conservative management is offered in patients with partial thickness tears or small full thickness tears, or in elderly patient where fitness for the surgery can be an issue. The conservative management includes rest to the injured shoulder, medicines in the form of NSAIDs to alleviate the pain, and physiotherapy and its different modalities. Intra-articular injections like steroids can be given to reduce the inflammation and alleviate the pain. And orthobiological agents, now many profound research is going on in this subject, whether platelet-rich plasma or stem cells can be used for the treatment of rotator cuff tears. Operative treatment is advised for medium and larger tears, and where the conservative management has failed to give relief to the patient. Operative treatment can be advised at first consultation to particular patients with partial thickness tears and some small tears if the patient is young, high demand patient, or is an athlete by profession. Different surgical treatment options are available, but arthroscopic rotator cuff tear repair